Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and take actions that can make the system better for all of us. There is a pink tax on healthcare. An analysis from Deloitte, the accounting firm, found that women on average pay more for healthcare than men, despite having the same insurance. Even after removing maternity costs, women with employer-sponsored health plans paid $15.4 billion more in out-of-pocket expenses for care than men did. Some of the excuses given were gynecological exams and breast cancer screening. So I guess that all the excess heart disease that men have, that doesn't count. And prostate screenings, that doesn't count. Look, when insurance stands between you and your doctor, the insurance company wins, not you. Okay, let's talk about reproductive health. There's a reproductive Taliban activity going on in Congress, and let me tell you what I mean by that. Do you remember the Supreme Court Dobbs walk back the ruling to 1950? Leave it to the states? Republicans have submitted a bill in Congress to make Mifepristone illegal. That is one of the two drugs used in prescription-related abortions. Now, let me tell you, if your goal is to make women second-class citizens, incapable of making their own life choices and decisions, then you are no better than the Taliban, and you certainly deserve to be called that. Representative Andy Ogles and a number of other Republicans introduced a bill last week, H.R. 5806, that would ban abortion pills nationwide. Not state by state, nationwide. And his comment, banning these dangerous drugs for the purpose of chemical abortion is an important step in protecting life. Not the woman's life, of course. The new bill, which has 13 Republican co-sponsors as of last Thursday, comes on the 23rd anniversary of the FDA approving the abortion drug Mifepristone for terminating pregnancy in the first 10 weeks. This bill doesn't just get rid of Mifepristone, it gets rid of the other medication as well that's used to support medical abortion with a prescription. So in recent years, the pills have become the most common method of abortion nationwide, about 53%. We need to let our representatives in Congress know that this kind of behavior is unacceptable. I will have the action in the description section below, but you can call your representative at 202-224-3121, or I have a link where you can get their email and send directly to them, or on your cell phone. You can text to 50409, sign, S-I-G-N, PSPXKM, and I'll read you the email that'll go. I'm your constituent, and I see that there is a bill in Congress submitted by Andy Ogles to make Mifepristone illegal. It is H.R. 5806, a bill to make chemical abortions illegal in the U.S. I do not want to hear that you have voted for this in committee or have voted to enact it. If you vote for this, you and me are quits. You'll get not one penny from me, no support, and you will not get my vote. Okay, that's the action. They got to know we're serious about this. Let's have some good news. We could sure use that. There is a new antibiotic that now shows effectivity against a complicated staph bacteria. Staph infections, you don't get these at home. You get these in a hospital. And sadly, they can be deadly. And it's not a small number. About 120,000 people a year get these, and about 25% of those people can die. It is just horrible. Anyway, the results of a phase 3 clinical trial now show that an antibiotic used for treating pneumonia could be an option for treating bloodstream infections caused by antibiotic-resistant bacteria. This was in the New England Journal of Medicine, and again, in the text in the newsletter, we'll have the link to that study so you can find it there. The trial was done at Duke University. It was funded by the Department of Health and Human Services. Thank you very much. It found that cephalosporin antibiotic ceftobiprole, I hope I got that right, was good for the treatment of patients with complicated Staphylococcus aureus bacteria, including MRSA, which is particularly deadly. Anyway, so that's good news on the infection front, because 25% of the 120,000 people every year die from that. Okay, let's have some more good news. RSV, or respiratory syncytial, I hope I got that right, virus is a common virus that causes cold-like symptoms for lots of people, but for the elderly and for young babies, it can be life-threatening. It is deadly. There is now a protection that's available. There's a vaccine for adults, and there is a treatment for young children. And the CDC guidance is adults 60 years and older, go get vaccinated. Number one, just go get vaccinated. A single dose will help you. For children, very young, infants and children, one dose of nirsevimab is recommended during their first RSV season. Now, I have a link to a Harvard study that explains how it works. It is not a vaccine. It is actually boosting the immune system of infants, because remember, they don't have much of an immune system, so you got to give them the antibodies. It holds on for about 5 months, which will get them through the RSV season. Additionally, children 8 to 19 months old who are at increased risk for it, they should get a second dose as they go into their second season. So important to know, I'm glad it's available. Also, if you're pregnant between 32 and 36 weeks, it's recommended that you also get the RSV vaccine. Great idea. Okay, so here's the summary on vaccinations. Influenza, RSV, COVID-19 shots, I'm going to get them all, but not on the same day. It's just like the last thing that the referee says before the boxing match starts, protect yourself at all times. Okay, that's it for today. Like, share, send me your comments below. If you want to send comments in mail, you can send them to healthcareadvocacy1@gmail.com. And of course, I'll have the link to subscribe to the newsletter also in the description. Have a great day.